Many thanks for staying with us on News Central now. Let's go straight to some health matters. Nigeria recently introduced the Human Papillomavirus, the HPV vaccine, into its routine immunization system, aiming to reach 7.7 million girls, the largest number in a single round of HPV vaccination in the African region. Nigeria has undertaken one of the largest vaccination efforts against the HPV ever in a fight against the virus responsible for nearly all cases of cervical cancer. Bettinah Nwelih reports.
Against the human papillomavirus into Nigeria's routine immunization system, a pivotal moment in the country's fight against cervical cancer-related deaths. The Gavi-led initiative is supported by the Ministry of Health, the World Health Organization, UNICEF, SIDANI, and various civil society organizations.
Introducing HPV vaccine into, the routine immunization system is a big milestone, and it's something that I think everyone should take. The response we're seeing is quite positive, though sometimes not exactly how we expect it to go, but we're seeing a largely positive response from community members, from schools, from parents, especially from the educated ones. We're seeing a lot of good response because they know what this means. For the more rural, remote areas, a lot of work has also gone in engaging with the traditional and religious leaders to make sure they are also able to pass the message well to their subjects and make sure that they get it.
The campaign was heralded by a 5-day mass vaccination campaign in schools and communities. Under the campaign, Gardasil will be administered to girls between the ages of 9 to 14 years. The vaccine is known for its high effectiveness in preventing HPV type 16 and 18 infections, responsible for a minimum of 70% of cervical cancers. Funding for the program was previously suspended in Nigeria because the country lacked a government-sanctioned and structured immunization program for HPV vaccines.
We still try to let the child know the importance of that vaccine. We let the child know, and when he goes back home, she should let even the parents know. Maybe another time, maybe the parent will find, since maybe this thing is finishing very soon. And if she misses it this time around, maybe next time she should not mix it. Because parents now are developing one kind of attitude. People are afraid of cultism, waiting, a lot of things. So some parents don't welcome such things. But we tried to enlighten the children yesterday concerning the importance of the HPV vaccine.
In Nigeria, cervical cancer is the third most common cancer and the second most frequent cause of cancer deaths among women aged 15 and 44 years. In 2020, the latest year for which data is available, the country recorded 12,000 new cases and 8,000 deaths from cervical cancer. Bettinah Nwelih, reporting for News Central.